diagrams in class to explain things, but seeing the inside of an actual human being compared to the diagram, sometimes it gives you a better idea how things are going on. So these are images of endometriosis, and you can see there's small areas that bleed into the body cavity. And as we mentioned, that this is something not everybody knows about this, and sometimes people are taken by surprise when they have difficulty with fertility later. And sometimes they can have cramping, and I think he was going to start talking about that, how sometimes the endometrial tissue can cause scar tissue and so forth, and a degree of discomfort. Okay, it can also cause scarring in the fallopian tubes, which can interfere with ovulation, a successful sperm transportation, and successful transmission of the fertilized ovum into the uterus. So anyway, I just wanted to show you that video, and this is how that type of surgery is investigated. Okay, so the next slide, we were also talking about fertility issues with male and females. So body weight, being overweight, can be associated with decreased fertility. For women, overweight can be associated with irregular menstrual cycle, which has to do with hormones, high insulin levels, less ovulation, and also something called polycystic ovary syndrome, which I'll cover on the next couple slides. And an increased need, if she's overweight, there's an increased risk for surgical deliveries, and also having large for gestational age babies. And then she may suffer also from breastfeeding challenges later on too. So the hope here is to lose only 5 to 10% of weight may help restore ovulation for people. So it's not a hopeless situation, but it does need, this is where the discipline comes in to help people. So men who are overweight may experience low testosterone, reduced sperm quality, and also with lifestyle improvement, they can also have some recovery. So this next one is talks about being underweight. And for women, underweight may be associated with reduced hormone production, and then amenorrhea, which A means without, and menorrhea refers to the menstrual cycle. Some women, when they get to a certain low body weight, sometimes low body fat and low body weight, will stop menstruating. And this is an emergency situation because women of reproductive years should menstruate. And if their body fat or body weight is so low that they're not supporting that, that's an indicator also of increased risk for osteoporosis. In fact, going for a year as a young woman without a period, and I'm not talking about people taking birth control, I'm talking about having amenorrhea due to low body weight, but going for a year with having that amenorrhea can severely increase risk for osteoporosis later in life. So it's important not to ignore changes like this. And it's important for girls to know this because, and women to know this because we have so much pressure in society to have a certain body size and to, if we're athletic, to not have any fat showing. And actually the normal status for women is to have body fat. That's part of what makes us female. It's part of being female, and it's also part of reproductive health. For males, the risk for underweight is also less testosterone and reduced sperm quality. So this is review for you, just kind of throw it in there that we consider overweight or obese over 25 and over 30 respectively. Now I mentioned that I would show you polycystic ovarian syndrome. And you just saw an ovary, so you kind of saw what it looked like. And this is a condition, sometimes it's called polycystic ovarian syndrome, sometimes it's called polycystic ovary syndrome. It's abbreviated PCOS. This is a common abbreviation, and this is pretty much well known in the medical community. Not all women know about it sometimes, sadly, until they experience it. So this is a primary cause of infertility. And here are the characteristics. Small cysts on the ovary. So here's a diagram of a normal ovary, and here's one with cysts on it. High levels of androgens. That androgens for humans are testosterone. So women with PCOS have elevated testosterone. Okay. Also, high levels of insulin. And this can end up leading to progression to diabetes. Okay, so there's metabolic dysfunction going on here. And let me give a little commercial for learning here. I can't see you guys, so I don't know if you're writing things down or how you're working on this. Please take notes. You do have take-home exams, and that's nice, but your final exam is not take-home. Your final exam is a multiple choice test given in the traditional style. So these types of questions will be involved. So be sure you don't kind of just relax so much that you're not learning. Okay, we'll give you a review for the final, but I promise you things like polycystic ovary syndrome will be on there. So this is important information for you to know as a health provider. Another symptom is amenorrhea. And then also because of the testosterone, there may be this male pattern hair growth. And so thinning of hair, some women experience thinning of their hair. There can be a variety of reasons for that. In fact, COVID stress is causing thinning of hair for some people. But PCOS is something to consider. Sometimes when people have to take medications for breast cancer, they also experience the thinning of hair because of the hormones that they're taking, depends on their medication. So there's a variety of causes of loss of hair or male pattern baldness, but it's important to access healthcare to see what's going on here. So another symptom is acne and oily skin, and also increase in abdominal fat. So and sometimes people experience pelvic pain. So what are the causes? One is genetics. It tends to run in families. So even though it is a cause of infertility, fertility can happen and people can have children, but the children also at increased risk for having PCOS. Another cause is having high insulin based on overeating and being overweight. So the insulin itself may be one of the causes to get this stuff started. And then another one, and this is so interesting, and I don't know how much time I'm going to have to cover this semester, but this is so important. There's a concept called intrauterine programming. And what this means is inside, while a fetus is in utero, during that time, the mother's hormonal environment based on her physiology, her things that she eats, her hormone levels, stress hormones, all different kinds of things, blood sugar, can all have an effect on development. And it's thought that the overweight, women overweight during pregnancy, that may increase risk for the daughter to later develop polycystic ovarian syndrome. So we don't change, the changes in her body that affect development do not change the genes, but what they do is they change how cells express genes and programming. So it can affect how the kids come out, what their health is like. It's one of the reasons that we want to talk about doing the best to maintain a healthy body weight to support healthful pregnancy, not only for the mom, but also for the offspring. So this is a hot topic of interest, but it does revolve around genetics and lifestyle. So what do we do about it? Weight loss can reduce the symptoms. Again, this is right in your lane. Specific dietary changes, consuming fewer foods rich in processed carbohydrates. You hear this in all of your classes. You've heard it for years. You know how to go about this. And also there are some apps that work pretty well for weight loss. This is the first time I've included this one in the class, but I've recommended Noom to a lot of people. I don't know if y'all have heard the advertisements for this, but this is an app that has people write down their food every day, and it tells them how many calories they have. It's very simple to use, provides motivational information, and helps people get on track and realize where the extra calories are coming from. And the literature shows that one of the most important things when people are trying to lose weight is to write down what they're eating. And as soon as you start writing it down, you become very well aware of the foods that are probably contributing to too many calories and edging that weight up. And so they're not perfect, but it's very useful. I believe it's $100 for 4 months. I'm not sure exactly. So I just want to bring that up. Any comments about this? Okay. Another treatment is a diabetes medication, can help adjust blood sugar and can help with achieving pregnancy. And here's the deal though, if a woman with PCOS becomes pregnant, she has a higher risk for gestational diabetes, hypertension, and having small babies too, okay? So she can have large babies and she can also have small babies. So those are the risks that come along with PCOS. So the next factor that can influence fertility is diabetes. There are 3 types, and I know when I teach this in person, I review you on type 1 and type 2, even though I know you've had this before. And just a quick reminder, type 1 diabetes is the type of diabetes in which people stop producing enough insulin, maybe cease producing it altogether when it's all said and done. It's often triggered by it's an autoimmune response, but triggered by an illness can cause people to attack their beta cells of their pancreas, and they stop producing insulin, and they're absolutely required to take insulin in order to survive. That's type 1. Type 2 is the type of diabetes that we traditionally associate with overweight and obesity. Not everyone that gets this is overweight or obese. That is not the case, but you're more likely to suffer from this. And so these people have insulin, but the levels may be too low and the cells in the body don't respond to it. So this is background, just to remind you. And in this class, we talk about gestational diabetes. This is a 3rd type of diabetes. And this is one that occurs during pregnancy. So a woman goes into the pregnancy without having diabetes, but then develops diabetes, gestational diabetes during the pregnancy. We'll talk about this more during a pregnancy, but I want to bring it up here so you've got your head around it. Diabetes, regardless of the type, can affect the outcome. In fact, it's very serious. Okay, so if the diabetes, regardless of the source or the type, is poorly controlled, it can associate with infertility in women and in men. And if women do conceive, and this is what's so serious, if she does not have good blood glucose control, and this is easier for some women than others. Some women have a hard time, even though they try everything and getting their blood glucose regulated. But the poor glucose control increases risk for birth defects. And we'll talk about neural tube defects soon. But these are the defects that affect the development of the spine. Also, risk for having large gestational LGA babies, and complications of pregnancy. So diabetes, uncontrolled diabetes, is serious affects fertility and pregnancy outcome. A teratogen is a term I like to bring in here. The term teratogen refers to something that causes birth defects. An uncontrolled diabetes can be teratogenic, causing birth defects. An example that's different than this, we'll talk about with pregnancy, is high levels of vitamin A are also teratogenic. If women take too much high doses above the DRI, considerably above that, that can also cause birth defects. I'll talk about that. So teratogen is something that causes birth defects. Okay, celiac disease. Now we have celiac disease has been very popular for a while, where people have been carbohydrate phobic, I guess, and may feel discomfort after eating certain foods and self-diagnose as having celiac disease. But really, to do this right, people need to undergo the medical care if they have access to it to find out if they really have celiac disease. What it is an autoimmune disorder that occurs when the body reacts to gluten, which is found in wheat, rye, and barley. It's a protein conglomerate found in wheat, rye, and barley. And what happens is it causes an immune reaction to where we attack our lining of our own intestine and decrease nutrient absorption. So you can see here's your normal healthy villi that you've learned about forever. And then here's a flattened villi that's no longer functional in the same way. So what happens here is that nutrient deficiencies abound because we can't absorb these nutrients without this surface here. You've learned about this forever. So the results of celiac disease, if someone's not controlling it, okay, so controlling it is a lifelong gluten-free diet, but without control, infertility is an issue, and that's because of the poor nutrition status. Also, because her nutrition is poor, she's not absorbing the nutrients, she's more at risk for anemia, decrease in bone density, and cancer. So celiac disease is serious and needs to be investigated, but not over-diagnosed, not self-diagnosed. So pregnant women with celiac have increased risk for miscarriage, low birth weight babies, and preterm delivery. So this falls into the category of medical nutrition therapy, where if you were working with pregnant women and they have celiac disease, or if you suspect it, then you would recommend that they get tested for it. So how does somebody with celiac disease eat? This is from your book. There are other items besides the wheat and rye that we talked about. There's other grains that are fine. So my plate is the same, except for the items containing gluten. Now it's easy when you're talking about the grains, but where it gets tricky is looking at processed foods, because processed foods may contain small amounts of starches and that have some protein in them that can enough gluten in them to stimulate the reaction. So they need to be very careful. I've known several people with this, and some have to be extraordinarily careful. In fact, some people can't drink beer that has had wheat as part of the formula in the making of it. So even it gets that serious. Okay, hypertension or high blood pressure is another condition that can affect fertility. You know this, blood pressure, there's certainly a genetic component to it, but there's absolutely a lifestyle. So who's at risk? Older adults, just the older we get, the more likely are for our blood pressure to go up. People that are overweight or obese. And then also there's a risk, greater risk among African Americans. So knowing this risk helps. So there's lifestyle correlates: smoking, not exercising, eating a poor quality diet. These all increase risk for hypertension. Here you get lots of salt, and also being sedentary tends to cause accumulation of body fat and so forth. So hypertension is serious. It affects about 7% of women of childbearing age. And if she has hypertension, she's more likely to experience a condition called preeclampsia. I'm going to explain this under the pregnancy lecture, but briefly, preeclampsia is a condition that during pregnancy where her blood pressure skyrockets has an effect on the actual delivery of nutrients to the uterus, maybe resulting in small babies, and it actually can kill her. So preeclampsia is serious, and I'll talk about it when we get to nutrition, the nutrition in pregnancy. To reduce blood pressure, there's always the DASH diet. These things are simple, yet most people, if you look at most people's diets, they don't eat the DASH diet, right? The processed foods sometimes really crowd out those whole foods items. So here's a meal plan. I'm not going to belabor the point. This is just reminding you that the DASH diet is not made of Pop-Tarts, right? It's not made of donuts. It's made of real food. And there's been so much literature that has looked at the efficacy of consuming a DASH diet for improving weight loss and long-term health. There's really good literature on this. Okay, the next category is sexually transmitted infections. And there are 3 categories of sexually transmitted infections that can affect fertility. One is HPV, another is pelvic inflammatory disease, and another one is HIV. So I'm going to talk about this briefly, but the incidences of these conditions, these sexually transmitted infections, have risen kind of dramatically over the past several years. Probably not so much during COVID, but we'll see about that. So I'm going by these in order. So the first one was HPV. And this is a virus. We all have respect for viruses now, right? If you didn't have it before, you do now. There's 40 types of these viruses that can affect genitals, and most people don't, and the throat and mouth and throat, and most people don't know they have them, right? There may be no symptoms, they're silent, it doesn't seem to cause any problems. And the body can clear the infection in 2 years. there's a couple of types, and I won't ask you the numbers, I'll just tell you this because we know it, that cause genital warts. Okay, so there's a couple that cause genital warts. So unprotected sex is more likely to lead to things like genital warts. And this, it's my understanding that this is a pretty painful surgery to have these removed, and it causes a great deal of comfort. So besides not getting other sexually transmitted diseases and preventing pregnancy, it's important not to have unprotected sex to protect from these viruses too. And then the other types, 16 and 18, are associated with anal and cervical cancers, and vaginal and vulvar cancers, and penile cancers. And these are the ones where when women get pap smears, they'll take some scrapings from the cervix and look at them. And what they'll see is a difference in the cervical cells, normal versus having HPV. And so this sets up a red flag. And so people need to continue being treated to see if the HPV goes away, and this can certainly affect fertility. And let me give a commercial for vaccination. I know there's a lot of naysayers about vaccinations now, but vaccinations save lives. This, for people that are going to be sexually active during their life, which is about everyone, a vaccination can be given during the early years for girls and also males now. And the vaccination protects against infection with these forms of HPV that cause these problems. So the CDC recommends vaccination for girls ages 11 to 12. And then they've recently okayed the range to be greater. Sometimes parents are concerned about this because there's a bunch of anti-vax movements, people that are misinformed about what vaccinations do. And also it's difficult for parents sometimes to predict or to realize that their young girl is going to be sexually active one day, and it may feel uncomfortable, but they're going to be. Right? This is human condition. They're going to be. And so both males and females need these vaccinations so that they are all protected. Latex condoms, regular use may be about 70% effective. This is not an easy lecture to hear, I think, for college kids, but it's so important. I think it would be useful for everybody to really understand what's going on and the risks involved. Okay, the second category I want to talk about of sexually transmitted infections is pelvic inflammatory disease. Common causes, there's a couple of bacteria that cause pelvic inflammatory disease. And these are untreated bacterial infections. And so the risk is people douche. Sometimes they use a water flush to flush out the vagina. They may use an IUD, engage in multiple sex partners, and being young in general is associated. And so what you have with this, if the bacterial infections are untreated, then they don't stay in the cervix. They can move up into the uterus and even in that whole area and cause scar tissue here, like in the fallopian tubes, and can basically have long-term effect on fertility. So the bacterial infections are one thing. Pelvic inflammatory disease refers to a later stage of untreated. And some people may have no symptoms, or they may be uncomfortable. And a risk of this is having an ectopic pregnancy. Sometimes pregnancies embed in the fallopian tubes instead of in the uterus. And so that is a medical emergency where the fallopian tube will burst and increase her risk. So that has to be surgically handled. So what I like people to understand here is that some people have symptoms and some don't. In the exam questions, we always ask this because I want you to know that people that sexually transmitted, that PID and some sexually transmitted infections can be silent and have no symptoms. So that's why, another reason why we need health care. We need well woman care. Texas is at the bottom of the nation in providing for low-income women. And so many low-income women they've been removing resources for women, and many women have nowhere to go to get tested for things like this. And so that perpetuates a health disparity where low-income individuals have less access to healthcare, and this can affect their fertility and then affect their entire life. So the advice, prevention is great, and we've tried absence education in high schools. It doesn't work. I'm not saying I have an opinion about it, except that what the literature says is the education itself doesn't work. Condom, that would work. If people were abstinent, that would work. Regular use of condoms would work, and having healthcare to be tested for STIs would help. And also, if people find out they're infected, they need to explain to people that they have had sexual relations with what's going on, so they can also protect themselves. So what's sad about this is people may not know they have it until they're in a stage of life where they want to reproduce, and then they can't do it. Okay, the last category of STIs is the human immunodeficiency virus. Again, here's with the viruses. Everybody's familiar with this now. This is a virus that does not cross the blood-brain barrier, but mom should have, if she wants to reproduce, she should have optimal nutrition status. Counseling is needed to ensure her medications are optimized, and actually I've read some papers on this recently. There's pretty good evidence that the cocktails that they use to prevent full-blown AIDS can help protect her from having symptoms and also from transferring her HIV to the fetus. Now, the mode of delivery matters because vaginal birth may transfer it, and so there may be other choices and how delivery happens. But they do need to avoid breastfeeding because that is a way, in the United States, that is a way to transmit HIV. This is a complicated issue. So I'm just kind of letting you know that there are issues, and if you work with pregnant women, this is a medical nutrition therapy type issue that you would want to learn all about HIV and all about HIV and pregnancy, and look at those papers to see what recommendations are. There's a lot of ways that people become HIV infected, and so it's just important to know. Okay, I'm going to cut this slide and go to because the next presentation starts with improve the health of sperm. I, for some reason, had it in there twice. So now sharing part 2. This is a continuation of preconception nutrition. We will talk about recommendations prior to pregnancy. We'll begin with men and again talk about how men what they can do to maximize the quality of sperm for reproductive purposes. And we'll talk about women, and we'll talk about those likely problem nutrients. As you remember, every time we talk about a group of individuals with a risk for, if in a particular age group or stage of life, we focus on potential problem nutrients. And so that's what we'll do with prior to pregnancy and pregnancy. They pretty much overlap. We'll talk about what recommendations for prenatal vitamins, and talk about a few other things that we need to have recommendations for. Finally, I have a video for you to watch for this. So, as promised, for men, this slide indicates how to support optimal sperm. And, a lot of the, I don't know if burden's the right point of view, but a lot of the burden of being healthy falls on the woman because she's the person that carries the fetus. But both people are important, and the lifestyle of the partner is important as well. A healthy diet, providing zinc, lots of produce and whole grains and healthful fats can make a difference in sperm quality. So zinc is provided, lean meats, fish and poultry, and up to the UL in supplements is recommended. Produce, we recommend this for everyone, provides antioxidants and folate, which help protect sperm integrity. Half of the grains are whole grains and so forth. Healthful fats, your omega-3 fatty acids and so forth. Not high in fat, saturated fats, but a healthful diet. So what are concerns? Alcohol, excess alcohol consumption, and I have been reading papers about how alcohol consumption has gone way up during COVID. and how more and more young people are experiencing fatty liver disease and even cirrhosis, which causes permanent damage to the liver and death. They can develop hepatitis from drinking too much. So it's become a lifestyle, certainly an accepted lifestyle in the United States, and we need to be careful about it. We have our times of life where people that are interested in drinking may drink more than they need to, but it needs to settle down, because alcohol can affect fertility and also quality of sperm, which affects exactly the fetus. So no recreational drugs are considered safe. You know, I haven't looked at the literature on pot since last year, but there's, you know, at least we can study it now. At least, you know, we can't do studies where you divide people into two groups and have one group smoke pot and the other group not, but we can do natural studies to look at pot smoking and sperm structure. And so it indicates that increases risk. I also read studies that drugs like cocaine can have permanent effects on the outcomes of the fetus. So lifestyle for parents is not the partying lifestyle, in summary. So no smoking, avoid obesity, avoid saturated fat, avoid radiation. Same with women, right? If you have to have an x-ray, you wear a leather over the reproductive tissues. And one thing you may not be familiar with is avoiding environmental toxins. We have so many toxins in our environment now, related to pesticides and plastics. Our plastics have gone out of control. We have plastics in all of our food now. Our body has plastics in it. Seafood has plastics in it. Animals in the oceans are eating plastic, and the plastic in the ocean turns into small little pieces and gets incorporated in the tissues of organisms. So we need to clean up our environment and then do our best to eat a whole food diet, but we can't protect ourselves from all of this. But pesticides are something that we could probably avoid, and also use of plasticizers in your diet. So don't use hard plastic cups or those water containers that are made with hard plastic. Instead, use stainless steel, because the stainless steel is protective, but the plastics can change reproductive ability. So get rid of them. If you've got some on your desk right now, don't use them anymore. And then here's a stainless steel one, and there's 10 billion of them that you can buy. And that would be the permanent way to go, also for children. Okay, so now I'm going to focus on women. And I indicated that the likely problem nutrients prior to pregnancy would be folic acid, or that's what I would cover. So we'll cover folic acid, iron, iodine, choline, and omega-3 fats. This is not all the nutrients that women need, but these are the ones that, if she is deficient, can cause the most negative outcomes. So it's really important for her to besides a healthful diet, to make sure that these nutrients are consumed in sufficient amounts. So first, folic acid. It's critical for preventing neural tube defects. I have a picture of asparagus because it's a good source, but there's lots of good sources, which we'll talk about. Now, in this class, I've vacillated with having great detail about chemistry and then pulling it mostly back. So I like to show you the structure, but I will absolutely not ask you the structure except for a couple of basic concepts. So this shows you, this is a picture of folic acid that we find in a supplement. You've heard the term folate and folic acid before, so I'm going to tell you the difference between them. Folic acid looks like this. It's got a terpene ring, aminobenzoate, and glutamate. Okay, you don't have to know the parts, but this is what it looks like. The stick figure is a little more helpful here. So you can see what the form of folate in supplements is. It's called monoglutamate. Glutamate is an amino acid, and supplements only have one glutamate on the structure of folic acid. Okay, so that's what supplemental folic acid looks like. Now, folate is a form found in food, like in your spinach, okay, and a variety of other sources. So this is the same structure, except look how many glutamates are here. Instead of just one, like supplements have, naturally occurring folate can have a chain of glutamic acid residues on it. Changes the structure. This changes how well it's absorbed. So folic acid that is 100% folic acid from supplements is very highly bioavailable. We basically absorb all of it. Food folate, on the other hand, without supplements, is about 50% bioavailable. And the combination here, folic acid and food folates, the absorption is about 85%. So there's a difference in the absorption rate. Now, I don't have people do calculations on this because I don't think you need to do it. But labels, our recommendations are reported as what are called dietary folate equivalents. And we don't have to know so much. We just need to know that the DFE, the food provides what percent of a DFE. So it's a dietary folate equivalent, and they take all this stuff into consideration. So if you look at a table and you look up spinach, it tells you how many DFEs there are. And the DRIs revolve around that, so it becomes a little bit easier to consider. You don't have to know the difference yourself. Now, this is the only, I believe, technical slide. But take a minute because this will help you get your head around how important folic acid is. And it's folic acid works in the body. We can consume folic acid or consume folate, but we break it down to folic acid. And this is what works in the body. And it does two things that are very critical that affect fetal development. One is synthesis of DNA. So think about it. A fetus is growing. In order for growth to occur, DNA synthesis has to occur around the clock, right? Because cell division is occurring. So in order for cell division to occur, we need to keep replicating, and so forth. All right. And then also, part of this process, besides replicating to make more cells, is we attach methyl groups. This is a methyl group, CH3. We attach methyl groups to DNA. Folic acid is involved in both DNA synthesis and in methylation. Now, I have more information on here, but I'm not going to go into detail. Like I said, I vary on how much detail I go into. But what I really want you to know here is that we need it for cell replication, and we need it to methylate DNA, which affects how our genes are expressed, which affects development and things like closing the spinal cord. So why do we care so much? So remember, there's two things. It's DNA synthesis and DNA methylation, two primary functions. And why do we care? Well, the issue with prior to pregnancy is folic acid status has to be good before conception. So in other words, people can't be protective. They find out that, that they're pregnant and then try to start taking folic acid. They may not be able to be protective. So her status needs to be good prior to conception. So that's because the closure of the notochord here that occurs, it occurs 17 to 30 days after conception. Oftentimes people don't know they're pregnant and so on. And so if the neural tube closes, that prevents neural tube defects. This is a picture of a neural tube defect where instead of this being closed, there's open, and this is a kid born with spina bifida, okay, which is a neural tube defect, which is basically a bulging of the spinal material out the body. And so it's important for everyone to know how serious this is and that it can be prevented. And that's what's so cool about understanding this. Nearly half of the US pregnancies are unplanned. That's important. So if that's the case, that means people need to be healthy prior to pregnancy. So everyone of reproductive years should consume enough folic acid. And sadly, about 3,000 women per year deliver babies with neural tube defects like this. If women consume enough folic acid prior to pregnancy, it can help them avoid neural tube defects such as spina bifida. So let's take another look at this just to make sure this is clear. So this is early on. Remember, during the first 30 days, the neural tube closes. So this is a picture of the neural tube, neural groove, and then the neural tube itself. So what we want is we want this to close, okay? If it's open, and it doesn't close here, then that can't be fixed later on. People can't take folic acid after this, like a Band-Aid, and have it go in and close. It has to close at the right time. That means her nutrition needs to be good prior to conception, because this mess happens so early on after conception. Okay. Now, there are other nutrients besides folic acid involved, but folic acid is the one that we talk about here. Choline is important too. We'll talk about that a little bit. So here's an image. Remember, this is very soon after conception. And here's an image where you can see, here's fertilization, days, 4 cells, 3 days, 16 to 32 cells, 18 to 14 days. We've got implantation, 4 weeks. This is an embryo, and there you go. Closure of the notochord already happened way early on in pregnancy. Okay, so why do some people have such poor folic acid status? Well, this is an obvious one. Low intake is a problem. Also, so there's 2 reasons. And here's your low intake food. Okay, now actually, folic acid is present in this slide here, this image, and it's present in the white bread, because folic acid is added to white flour. We added folic acid to white flour a long time ago because people don't eat plants, which are really good sources. Okay, so we've added it to flour to help the population have better folic acid status. Now, that's one is diet, and another cause is genetics. Some people have a SNP. I know you take genetics and you learn about this, but they have one little change in a nucleotide for a gene that codes for this enzyme. And in your genetics class, you'll go into this detail. So I just like to include it here for emphasis, but I won't ask you the name of the gene here, but you'll need to know it for your genetics class. But some people have a polymorphism in it for this gene, and so they're genetically more at risk for not closing the notochord. So for them, diet is even more important. So what are our recommendations? Remember, we talked about DFEs. This has to do with a number that takes into consideration absorption from folic acid and from dietary folate. And so when you look up folic acid in tables, the units are called DFEs, okay? And they take into consideration absorption. So for not being pregnant, the DFE, the DRI is 400, pregnant is 600, lactation is 500. So here's the serious recommendations here. Prior to pregnancy, this is serious. I always ask this question. I like to ask it in essay questions and in multiple choice questions and so forth. So you need to be well-versed in this. Prior to pregnancy, all women of childbearing age should consume a folate-rich diet, that means food, and take a supplement, 400 DFEs. In particular, at least 1 month prior to conception, take the DFE, and it's safe up to, or the 400, it's safe up to 1,000. And it's safe or higher if someone has already had a child with a neural tube defect, then they're recommended to take 4,000 DFE. This is also safe, okay? It's just not recommended unless someone has this history. So during pregnancy, women should take 600. So this is important. Here's some food sources. You find them in supplements and you find them in whole foods. And here's a slide that shows you food sources of folate or dietary folate equivalents. Notice how it's kind of spread out. So this is in DFE. So oranges, orange juice. These guys have done a lot of commercials and public service announcements on the importance of orange juice. It's a good source of folic acid or DFEs. Black-eyed peas, kidney beans, spinach, asparagus, broccoli, highly fortified cereal, and so forth. Notice that it's spread out, and notice this is not junk food. So we have the ability to eat a whole foods diet and have a pretty good intake of folic acid. This is never a bad idea. For someone that's pondering pregnancy, if you want to take a vitamin supplement, that's fine. It's so easy to do. It will not hurt. Multiple vitamin and mineral supplement will not hurt, especially if the diet is a little edgy. But if they want to eat cereal, something like Total cereal that provides that amount too. That's not a bad idea either. Now, we also, as I indicated earlier, our white flour products contain fortification because of the risk of neurotube defects. And once we started, this is a public health change, once we started adding folic acid to flour, the incidence of neurotube defects went down in the population. So it's a good idea to do this. Okay, any questions about folic acid before I move on to iron?
Is too much folic acid ever a problem?
So that's a really good question. In a real class where we could talk, I sometimes go off on this a little more. So let me talk about it a little bit because it's a good question. It's not a big deal. The UL is actually based on the fact that if someone has B12 deficiency genetically, some people have that. If they have a condition where they're genetically B12 deficient, if they take high doses of folic acid, it will mask symptoms of deficiency. So really the high level that UL is to keep people from taking so much that it interferes with detection of that nutrient deficiency. There's also been, and I'm vague on this, so I'm going to answer real vaguely. There's also been some studies that indicate, maybe there's too much folic acid may, in someone with different genes, may affect development in another way. But that's as vague as I'm going to be. So I'm not going to unequivocally say that, oh, this is perfectly safe, everybody take it. I would follow these guidelines. I sure wouldn't get into taking high levels of UL without doing a good literature search on it. Thank you. Okay, so the next nutrient is iron. Remember, we're going over problem nutrients. This is one of the most important nutrients worldwide for pregnancy in children. We've talked about it before, how important iron deficiency anemia is in infants and toddlers. Remember, it's associated with permanent decline or decrease in cognitive function. So iron during pregnancy, she needs to meet her iron needs and then also the iron needs of a developing fetus that is involved in growing their own red blood cells. So it's growing an entire blood population for another person with her iron intake. And it's easy to not consume a diet rich in food sources of iron. So why does it matter so much? Iron is critical for making hemoglobin for the red blood cells. I know you guys have had this background. Myoglobin, which is the iron binding protein in muscles, right? And then remember the electron transport system that's used to harvest energy from nutrients. We need some of those proteins need iron. We need iron to make neurotransmitters, and it's important for cognitive development. So this is a serious list of why iron is important. Critical, absolutely critical for development. Inadequate intake can result in depleted stores. She may have no stores, or she can have full-blown anemia where her blood cells levels are low. So this is a picture of a slide of a sample of blood that has the right number of red blood cells in a person with good iron status. And here's a slide of someone that is anemic. And without adequate iron, we cannot make hemoglobin and myoglobin in order to regenerate our red blood cells. We make these about every 3 months, and we turn them over, and so we can't do it. So, and what's that going to do? Well, her energy levels are going to be absolutely terrible being anemic. And I've had anemia before, and it's not trivial. And if she's anemic at conception, it can impair a child's cognitive function because she won't have enough iron stores to help foster the positive amount of iron that's needed for the fetus and fetal development. So that's serious. And also cognitive function, I have all those things listed here, but also growth too. So the bottom line is, prior to pregnancy, we want to correct anemia. So this is why diet prior to pregnancy matters so much. So what are the recommendations? Okay, the recommendations are, and here's your numbers again, and I do ask these numbers, folic acid and iron. These are critical to have any understanding of nutrition prior to pregnancy and during pregnancy, you need to understand, to have these numbers. Somebody needs to know them. You can look them up in a table, but if you don't have a working knowledge of it, you're not very useful when you're talking to people one-on-one about what they need to consume. So prior to pregnancy, she should be consuming the DRI, 18 milligrams per day. This is higher than it is for men. And that's because women menstruate, right? So women lose iron monthly from menstruation. Now, not everybody does, because some people take birth control and they don't menstruate. So probably their iron requirements are a little lower, but this is the DRI. And some women menstruate very heavily and they can sometimes not be able to keep up with their iron status with diet. They may need medication and some work on that. So this is, I hope, old hat too. There are dietary components that help us absorb iron. Vitamin C rich foods consumed with meals help. So with your spinach salad, have some, that's got vitamin C, but have a few mandarin oranges in there or something like that. So food sort of have some broccoli with the meal. And then also heme iron, there's two kinds of iron. If you don't remember this, please take good notes on it. But there is heme iron that is found in meat, fish, and poultry. And this is easier for us to absorb. And then there is non-heme iron that's not part of a hemoglobin molecule, found in beans, fruits, and vegetables. So our diets, if we eat meat, contain both heme iron and non-heme iron. Okay, so don't make the mistake of thinking, well, I need to eat as much meat as possible to get that heme iron, because actually a balance is ideal for providing good iron status. We eat a little bit of heme iron and quite a bit of non-heme iron. But the interesting thing is, if we eat them both together, heme iron helps us absorb non-heme iron. Here's an example. If you eat meat, you have a bowl of chili made out of beans. You should have beans in your chili. So you have beans. Beans are going to provide non-heme iron. If there is some meat added to that, then the meat will have heme iron, and absorption of this non-heme iron is increased. So combining foods helps heme iron with non-heme iron and also with vitamin C. Now, there are a few foods that actually limit iron absorption. This doesn't mean don't eat them. What it means is don't eat them all the time as your major foods. This is where we need a variety of foods. So spinach has oxalic acid, also called oxalates, and then this binds iron and calcium. Fiber, a high fiber meal contains phytates. I'm talking fiber from like whole wheat. Phytates also binds minerals, makes them less bioavailable. Tea and coffee also decreases bioavailability of iron. Dairy products and calcium supplements. You look at this and you go, well, how am I supposed to live? Well, here's how you do it. You can go ahead and live. If you want your tea and coffee, have those at different times of the day. It's not going to ruin your absorption of iron for the whole day. So have this for breakfast and then eat for iron for dinner. Plan your meals and just don't have tea and coffee with dinner, right? So you don't have those at the same time. When I'm talking about fiber, I'm talking about huge amounts of fiber where you're, on the bleeding edge of eating more fiber than you could possibly consume. Moderate amounts of fiber, with making most of your grains, whole grains, and so forth is absolutely recommended. Okay, it's recommended for all the health reasons too. So anyway, this just gives you an overview. And if you need calcium supplements, which really aren't recommended that much anymore, but if somebody needs to take them, don't take that with your iron-rich meal either. Take them at a different time of day. So
is the oh, just kidding. I was going to ask if tea and coffee was related to caffeine, but it says tannins right there. Never mind. I apologize.
You're fine. No, you're fine. Okay, and so here's some ideas about where we get our iron. And, fortified cereal, again, multiple vitamin mineral supplement. If someone has a bad diet, it's never a bad idea. But look at all these nice whole foods that provide iron. And white beans, for example, have a really good amount of iron. So incorporating legumes in a diet is a great way to increase iron consumption. so the next nutrient that's critical is iodine. And here's the importance. We need iodine for thyroid hormone synthesis. And if we don't have enough iodine, what happens in severe deficiency is people actually develop a goiter where the thyroid gland is. The cells replicate too much and they become large, and there's not enough iodine to make the hormones that are needed. And so this is what happens to the individual. We need thyroid hormone because it basically regulates everything. Metabolism, energy production, ovulation, cell division. We just absolutely need our thyroid hormone. And mild deficiency can affect infertility. And it's not uncommon for people to have hypothyroidism. So this is another argument for well-woman care, for people to have access to health care, whether they are well off or not well off, because it's not difficult to do a test for thyroid stimulating hormone to find out if there's a problem with thyroid status. And if there is one, medication, there's some synthetic thyroid hormone that's so inexpensive and such an easy fix, can just fix things. Okay, so this is what happens to mom or an older woman. And if a pregnancy has iodine deficiency, then this is what happens with development. So it's dead serious. So we want to make sure there's enough iodine in the diet. Now, the recommendations, not pregnant, and lactation. Here's what we need enough, we need thyroid hormone. Some people just don't make enough thyroid hormone because of their own genetics, but if they're not consuming iodine, that's going to limit how much they can make. So what do we say? Well, seafood is a good source of iodine, and so is iodized salt. Now, we trash salt all the time, but we do need salt, and iodized salt is a very good idea and I recommend this for everybody pretty much across the board because we may not be consuming enough iodine otherwise. And take a supplement if intake is low. This is prior to pregnancy, remember. And I'm not going to worry about this. There are some foods that can interfere with thyroid function, but I don't think anybody really eats enough of those foods in the United States for this to matter. There's foods like cabbage and Brussels sprouts and stuff that have an effect, but don't worry about it. It's not a realistic problem. And also exercise, which is what we need to do.